Hello, I'm Dr. Preeti Sharma and I'm intervention cardiologist at Max Super Specialty Hospital, Dehradun. And I'm going to talk about drug-coated balloons today. And as we all know that drug-eluting stents have been a standard of care for a long time. And being an intervention cardiologist, we have maybe implanted thousands of stents. Despite giving best of the results, we all are aware that these patients, sometimes they do come back. And they can come back in 6 months, years together. So this is the problem with drug-eluting stent, that your patient is not risk-free and they will need a therapy or maybe antiplatelet therapy for a couple of maybe months or years together if they are at high risk of having any cardiovascular events. So now we have a good tool in market. Now we have drug-coated balloons. What it does is it actually, after dilation, you just go there, put a DCB and release the drug in the native artery. So there is no permanent implant in the artery. And when there is no permanent implant, there is no need of having a long-term DAPT or what we call the blood thinners or antiplatelet therapy. So patients, Indian patients per se, I would say diabetic patients, more of them, they will have a diffuse disease, like their arteries are diseased from top to bottom. And if I'm implanting multiple stents, then I'm sure that this patient is going to come back with some kind of blockage again in the stents. For these scenarios, I think drug-coated balloon has an upper edge. You do a drug-coated balloon from distal to proximal and just release the drug there, and then you have a good, nice result. And with time, we have seen in our experience that these arteries, they grow. So if a 2.5 vessel, this will look like a 2.75 or 2.65 if you do a check angio for these patients. So there's no permanent implant. There is no fear of having a therapy which can produce bleeding in certain group of patients. So this is actually, and the long-term outcome of these patients are actually good. So I would say nowadays in certain group of patients, the drug-coated balloons, they are better than drug-eluting stents, and we have seen good results in our clinical practice. Thank you.